Hello, my name is Dr.Fraum, and I'm an assistant professor of radiology with appointments in abdominal imaging and nuclear medicine at the Washington University School of Medicine in St. Louis, Missouri. I specialize in oncologic imaging with a focus on MRI and PET studies. MRI, or magnetic resonance imaging, is a radiology study that makes images of the body by taking advantage of the magnetic properties of human tissues. A prostate MRI is an imaging study that generates high-resolution images of the prostate gland, as well as the surrounding anatomic structures in the pelvis. So what can you expect when getting a prostate MRI? The examination typically takes 30 to 45 minutes to complete. It involves lying flat on a table inside a large scanner. A device called the surface coil is situated over the pelvis to record the magnetic signals from your body that are used to make images. Because the scanner makes loud noises during the imaging study, headphones are typically worn for hearing protection. Depending on the reason for the prostate MRI and the imaging center at which it is performed, you may receive a special liquid called contrast material during the examination. This contrast material, which is usually given through an IV catheter inserted into a vein in the arm, can be helpful in visualizing lesions within the prostate gland. Some centers may also use a device called an endorectal coil, which is a slender tube placed into the rectum and situated near the prostate to help record the magnetic signals that the prostate gland produces. However, as MRI technology has improved over the past decade, many imaging centers have found that they no longer need to use endorectal coils to generate high-quality images. So depending on the type of MRI scanner that your imaging center uses, an endorectal coil may not be needed for your study. There are several potential reasons that your doctor may order a prostate MRI. First, a common reason for a prostate MRI is that your doctor has done a test that has revealed an elevated level of prostate-specific antigen, or PSA, in the blood. PSA is a molecule that is produced at low levels by normal prostate tissue, but can be produced at higher levels by many prostate cancers. PSA levels can also be elevated for non-cancerous reasons like prostatitis, which is inflammation in the prostate gland, or BPH, which is age-related enlargement of the prostate gland. Because there are several potential reasons that your PSA could be elevated, a prostate MRI can be helpful in determining whether an elevated PSA is likely due to a prostate cancer versus one of these other non-cancerous causes. If the imaging study reveals a suspicious spot in the prostate gland, the images from the MRI can also be used to guide biopsy of this specific part of the gland. Second, a prostate MRI can be used to determine if a prostate cancer that has already been diagnosed by biopsy has spread beyond the gland to involve other structures in the pelvis. This information can be used to inform a discussion with your doctor about whether your prostate cancer would be best treated with surgery versus radiation, or potentially, if the cancer is of low risk, just carefully observed. In this latter scenario, prostate MRIs at regular intervals can also be used as a way of watching a known prostate cancer over time for signs of aggressive behavior that could prompt treatment. And third, and finally, in patients who have been previously treated for prostate cancer, who have a diagnosis of biochemical recurrence, meaning that PSA levels have started to rise again, a prostate MRI, potentially in conjunction with a PET scan or a CT scan, can be helpful to identify potential sites where the prostate cancer has returned. This information can then be used by your doctor to devise a targeted treatment plan.